Test tube babies are children conceived through an assisted reproductive technology. The main process of their growth is as follows, **I. In vitro fertilization stage **1. Ovulation induction **. Women first need to undergo ovulation induction treatment. This is because under normal circumstances, women usually release only one egg per month. To increase the chances of conception, doctors will use ovulation-inducing drugs to stimulate the ovaries to produce multiple mature eggs within one cycle. These drugs will regulate the hormonal levels in women's bodies and promote the development of ovarian follicles. For example, the commonly used gonadotropins can mimic the function of the body's natural follicle-stimulating hormone, FSH, enabling the follicles that might otherwise have been atretic to continue to develop and mature. During this process, doctors will closely monitor the size and number of follicles, as well as the changes in hormonal levels in women's bodies through ultrasound examinations and blood hormone tests to determine the optimal time for egg retrieval. 2. Egg retrieval and sperm collection **. When the ovarian follicles have matured, the egg retrieval operation needs to be carried out. Usually, under the guidance of ultrasound, a long and thin puncture needle is used to puncture through the vaginal fornix and enter the ovaries to aspirate the follicular fluid, which contains the eggs. This process is generally performed under local anesthesia to relieve women's discomfort. At the same time, men need to obtain semen samples through masturbation or other means. If men have difficulties in sperm collection, sperm can also be obtained through testicular puncture and other methods. 3. In vitro fertilization **. The retrieved eggs and sperm will be placed in special culture dishes and fertilized in a culture medium that simulates the environment of the human fallopian tubes. There are two methods of fertilization. One is the conventional in vitro fertilization. That is, a certain number of sperm and eggs are placed together to allow them to combine naturally. The other is intracytoplasmic sperm injection, ICSI. If the man has a low sperm count, poor sperm motility, or other fertilization obstacles, the doctor will select a sperm with a normal shape and good motility and directly inject it into the egg to assist fertilization. Generally speaking, the fertilization process will be carried out in a laboratory incubator. The incubator can provide a stable temperature, around 37 degrees C, humidity and gas environment, 5% carbon dioxide, to ensure that the sperm and eggs can be fertilized normally. **2. Embryo culture stage **1. Early embryo development The fertilized egg will start to divide in the culture dish. Approximately on the first day after fertilization, the fertilized egg will divide into 2 cells. On the second day, it will divide into 4 cells, and by the third day, it will form a morula with 16 cells. During this process, embryologists will closely observe the development of the embryos and evaluate their quality. For example, the quality of the embryos can be judged by observing whether the cell sizes are uniform, and the amount of debris. Embryos with less debris and uniform cell sizes usually have better quality and a relatively higher success rate after transplantation. 2. Blastocyst culture, optional. In some cases, the embryos will continue to be cultured to the blastocyst stage, which is approximately on the 5th to 7th days after fertilization. A blastocyst is a hollow sphere composed of an inner cell mass, trophblast cells, and a blastocyst cavity. The inner cell mass will develop into the fetus in the future, while the trophblast cells will form the placenta and other supporting tissues. Blastocyst culture can further screen out more viable and developmentally potential embryos, but not all embryos can successfully develop to the blastocyst stage. *3. Embryo transfer stage *1. Transfer process When the embryos have developed to the appropriate stage, usually the embryos on the 3rd day or blastocysts, they will be transferred into the woman's uterus. The transfer process is to gently place the embryos into the appropriate position in the uterine cavity under the guidance of ultrasound through a very thin transfer tube. This process is relatively simple and generally does not require anesthesia, and the woman may experience a slight discomfort. Doctors will decide the number of embryos to be transferred according to factors such as the woman's age and the quality of the embryos. To reduce the risk of multiple pregnancies, generally, the number of embryos to be transferred is now minimized as much as possible. For example, for young women with good quality embryos, only one blastocyst may be transferred. 2. Implantation and early pregnancy. After the embryos are transferred into the uterus, they will swim around in the uterus for a while. Looking for a suitable position to implant. The implantation process is the interaction between the trophoblast cells of the embryo and the endometrium. The embryo will secrete some enzymes to locally dissolve the endometrium and then embed itself into the endometrial layer. Approximately 1-2 weeks after the transfer, it can be determined whether pregnancy has occurred by detecting the level of human chorionic gonadotropin, HCG, in the blood. If the HCG level rises, it indicates that the embryo has successfully implanted and has started to secrete hormones to maintain the pregnancy. After that, the pregnancy process is similar to that of natural conception. The embryos will continue to grow and develop in the uterus, going through various stages of pregnancy, gradually developing from embryos into fetuses until delivery.